And thank you. And so then that's right click. Okay, should I use forward over here? I'll see how that works. So good morning. Hope that for you guys it's not like 3 in the morning as it is for me. So I may look a little bit weary, but I'm at least going to be giving you what's hopefully the good news. Marshall's going to be the Grim Reaper. So we'll, rather than having a break in between, we'll actually probably just go end to end and then have a bit more time for discussion, if that works out for people. So this is the good news right here, just a simple diagram. So this is what we're going to talk about by the end of things. This is something that I had produced 4 or 5 years ago. So this is simple because we don't talk about some of the more difficult problems that some of you might be thinking of. We aren't going to talk about the harm that health professionals can do. We're going to just talk about the good we can do. So we're not going to talk about the Radovan Karadžićs that somebody mentioned last time, or the Joseph Mengeles. We're not going to talk about how, say, even the Nazi time, the health sector and health methodologies, talking about purification, sterilization, extermination, that all of that was using public hygiene vocabulary. We're not going to talk about the medical model and how it negates some other models of health. We aren't going to talk about constructs from the first world versus the rest of the world. So we're just going to talk about positive things here. And another thing we're not going to talk about are things that you have mentioned in your introduction from a paper that Cecilia and a few of us had worked on. So complicating this particular model, talking about the military, humanitarian actors, development, and peace workers. So this is the simplified model for you all. So what is peace through health? This is a concept that started to develop at a university that I'm associated with, McMaster University, and it was considered to be an emerging academic discipline to study how health interventions in actual or potential war zones, and I've added zones of violent conflict, may contribute to peace, and how we define war or conflict or violent conflict. I think that most people in the room are familiar with some of the controversies around that, but we can talk about that during the discussion. And so during my 20 minutes, I want to give you some examples, and if you want more examples that we've been working on the ground in Afghanistan, Sri Lanka, Iraq, El Salvador, we can talk about those, but I'm just going to give you a few of the classic examples, then go back to the model, and then talk about projects around the world. And then Marshall's going to speak and talk about pitfalls and other things that we might want to consider if we don't want to do harm. So even though this is a positive presentation, of course, the impact of war and violence in the world is not really so positive. And seeing this child here in the center with a cigarette, that's an image that's always gotten to me. And I think whether or not we're health professionals seeing the cigarette there, it's more the eyes that disturb us. We know that we've got 300,000 people a year dying as a result of armed conflict, and the effects on society in terms of environment, in terms of economic costs. And then we saw the 4 horsemen yesterday, the nasty things that war brings, and war sometimes targets health services directly. And we know that in the next 10 years, war will become the 8th leading cause of disability and death in the world. And apparently, Murray and Lopez were just looking at direct effects of war. So we know that war is related to poverty, ecological degradation, disintegration of communities, poor governance, and human rights. War can cause these things, but those things are also things that can cause war. And Group 1 is going to be talking more about that. Both of those things can lead to health deficits. So if we just try to look at the connection between illness and war, but then we also know that health and peace are related, as the people in this room would realize. This again is from an article in Medicine, Conflict and Survival. So looking at definitions which may be found to be parallel. And so when we look at the WHO definition of health, Galtung and his definition of peace tends to be somewhat similar, and I don't think it's by accident that we think of positive definitions of peace, not just peace being the absence of war. And we think about both of these things as rights, and we think about how we promote these things. Anyway, I don't want to go over this thing in any more detail, but just to say that the interactions seem pretty obvious. So anybody in this room heard of this guy here? Arya Dunant? And what can you tell me about Arya Dunant?
I work for the Red Cross, so
yeah.
I know he's in 1863.
Mm-hmm.
Or in 1859 went through the northern Italy and saw Torino. He was watching a witness to a bloody war between the French and the Austrian soldiers. 40,000 people were killed, and he got civilians in the town or the villages to help rescue the wounded from both sides of the conflict. And in 1863, he established the Red Cross. And in 1864, the first Geneva Convention was established. So he's the father of the Geneva Convention. He's the father of the Red Cross.
Perfect. That was said better than I could. Yes. Do you want to add to that? Yes.
Because we recently considered ourselves a small, peaceful country. But one of the first operations we were running was in Denmark in 1864, when the war against the etc. So when we tried to be neutral and are taking care of all the wounded Danes and the Germans, we were kicked out. That was the Danish response to the Red Cross in 1860.
Really? No, that's a story that I hadn't heard. But no. But so Dunant was a business person. He wasn't a health professional, but he used a health message. And we consider this to be one of the first peace through health type of interventions. So both things that you mentioned. So saying that we needed a humanitarian response to what happened in the battlefield, so developing the Red Cross to treat wounded, but then also the second part of what you mentioned, actually having the first of the Geneva Conventions regulating the rules of war. So this was good as a health intervention, but if we consider the second part to be a peace intervention, and we consider other Geneva Conventions to be like that. So we see that health it can be a powerful force in terms of mitigating the effects of war.